My name is Katja Rasmussen and I'm a physiotherapist and I see mostly sports people.
My name is Karolina Everson. I'm the physiotherapist since 1996, but nowadays I have studied more about the fascia.
My name is Tina Rasmussen. I am the owner of Viby Physiotherapy. So I've been a physiotherapist for 16 years.
My name is Anja David Greve and I'm a physiotherapist. ADG is a clinic where we have many sports people, especially handball. Not only professional handball players, but also people as me, normal people. People who want to train and are very active in their daily life.
I use the Lightforce when I have patients with both overuse and overload problems. It's easy to use. The physiotherapists here like it a lot because the compliance with the patient is high. It doesn't hurt people, it's just a light touch, so it feels nice just getting the treatment.
They are very happy about the laser treatment. They get that kind of warm feeling and that's quite relaxing for the patients. And they are surprised that, especially with that acute pain or swollen joints, that it goes that fast. I primarily use it for the acute traumas for the knees, ankles, shoulders. The injuries I primarily see in sports.
Achilles tendon, arm, shoulder, normal overuse injuries, also some in the knee. I have also got good results by using it on the back, the hips also. Golf elbow, tennis elbows, yeah, I use it there.
Post-surgery, when the knees is very swollen after an ACL surgery. If they got an acute ankle sprain, I see a lot easier return to sport when I use the laser. Quite a difference.
For example, the plantar fasciitis, if it's really painful, so the Lightforce is really good there. But they can have the osteoarthritis in the knee or hip. I can use it with so many other ways.
Normally the Lightforce will shorten the period that you need to go to physiotherapy, so if you want to get well quicker, they'll be out running or working or whatever much sooner than if we only do exercises or manual treatment or something else.
The laser product does something that I can't do manually with my hands. The time I need to use is quite shorter, so it's easier for me because I don't need to worry about the time spent on it. That's relaxing for the patients, so they are very happy about it and they are quite surprised that, especially with that acute pain or swollen joints, that it goes that fast.
As a physiotherapist and fascia specialist, I am using the Lightforce like different kind of way. Not only the symptoms. I'm also looking after the real things what is happening in the body. So I use laser as a pain relief, but then I'm also mixing with the fascia manipulation.
Some patients have severe pain so that you can't touch them. Then the Lightforce is a good way of starting the treatment, getting trust with the patient.
The touch screen, and it's easy to choose the spot where you have the pain. There's a really good protocols in this laser.
You can just use the touch screen. When I need to use exact amount of watts, it's just changing the outcome of the joules. So it's very easy to use.
I really think it's easy, even though the problems with my patient can be different. I can use it, so you can use it.
It's transportable, it's on battery. We've got a long drive for the different matches and then I can take it with us in the bus. Lightforce was a good investment because the patients are happy to pay a premium to get that extra treatment. In the clinic, the time can be an issue, so it's very important for us to be able to just take in the laser to use in a treatment, not worrying about if it's possible in the time in the clinic.